nuclear medicine people are just radiologists in the lab coat. Is it true?
Nuclear medicine is still practiced as a super specialty after you do your radiology training.
Do you think this branch is safe for women?
It is absolutely safe. Rather, I have more women nuclear medicine physicians in my team.
Boss, what are the biggest myths that you have heard about this branch?
So the biggest myth was that it is not safe for the radiation workers.
This branch is so much infra and tech dependent. What about AI? In the upcoming times, AI can literally take away all the jobs of nuclear medicine physician.
And it has already started affecting the different fields of life.
Is doing a private MBBS worth 1 crore worth it for the career in nuclear medicine?
Career in nuclear medicine today is worth a while.
What is the salary, the income potential in nuclear medicine? We are building India's largest community of medicos, and thank you for making this a success. I am Nachiket Bhatia, and today we have invited a very special guest. Nuclear medicine was one of the most demanded branches in our comment section. And trust me when I say this, I searched well and everywhere to find the perfect guest. And I actually found him. He is a graduate from Maulana Azad Medical College, Delhi. He did his DNB in Bangalore from Narayana Hrudayalaya. He is a fellow in European and Asian nuclear medicine boards and is certified in nuclear cardiology from USA. He is the co-founder, managing director and chief nuclear medicine physician of Molecular Diagnostics and Therapy. Probably the chain which is the fastest growing in India, having 4 centers in Delhi NCR, many more in the future, and doing the most number of therapies and diagnostic treatments of nuclear medicine in a single day in whole India. He has an amazing, impressive resume and the best person to answer each and every question about nuclear medicine. So let's put our hands together and let's welcome our leading expert in nuclear medicine, Dr. Nikunj Jain. Welcome, Dr. Nikunj, to the Nachiket Bhatia Show.
Thank you so much, Dr. Nachiket. It's a pleasure being here, and it is really nice to see the inquisitiveness regarding nuclear medicine.
Boss, our students, our audience are dying to know everything about nuclear medicine. And I'll tell you a secret here also, because nuclear medicine is something which we have heard on paper, but I don't see many people around there. So the proper information regarding this branch, I'll tell you honestly, is still not there. So the main reason for inviting such an esteemed guest for this podcast is to get the honest truth about this branch to our public, to the audience, so that they can make an informed decision whether they should choose nuclear medicine or not. So before we get on to all that, I would like to know everything about Dr. Nikunj, how you started, what was the purpose of getting into MBBS when you could have got into BTech or any other branch, and the biggest question, why nuclear medicine? Your rank was pretty good. You could have chosen any other branch, but I think 10 to 12 years back, nuclear medicine, that was a very bold step. So let's start with the first 2 questions and then I'll put the major question on you, why nuclear medicine?
Great. So I come from a doctor's family, and very closely I've been observing my parents practicing medicine all their life. I could see the disciplined life that they had. And the way they were giving back to the society by doing medical camps and everything. So it was quite stimulating to think as medicine as a career for my own self. So science was one of my favorite subjects. So putting everything together, when you see the society giving back to the parents in terms of respect and the blessings you get, so everything coming together, it somehow, strengthened my desire to become a doctor. Taking it further, during MBBS, we never thought of what to do. And it was only after we finished the final year and during our internship, I started researching and reading about different career prospects. and I was meeting multiple people. And my parents, since they were doctors, they were also making me meet different people. And one of the family friends, they suggested you should think about nuclear medicine, and that was the time when I started researching about it. And finally, I came to a conclusion that what cardiology was in 90s and early 2000, oncology will be in the next few decades. And I wanted to do something around oncology. A 9 to 5 job always fascinated me. So it was another reason that one of the positives regarding nuclear medicine. It had a fair share of thyroid clinics wherein you were uh, treating patients, writing prescriptions. And I also wanted to create an enterprise wherein my presence is always not necessary to run that enterprise. If I'm on a vacation or if I'm on a leave, that the systems are running. And so nuclear medicine was fitting all the bills practically. So that was why I chose nuclear medicine practically.
At that point of time, you must have been getting other branches also. But you see, as a PG, I mean, as a NEET PG aspirant, once you clear NEET PG, what you are, 25, 26?
Yeah.
I don't think so. Any student can think about 20 years later, that what we want 20 years later. Nuclear medicine was a very risky choice. So you must have, taken the pros as well as the cons. You have given us the pros. What do you think of the cons also here?
So at that time, the cons were the infrastructure cost was very high. So you couldn't think immediately starting a nuclear medicine setup. Though I always wanted to do my own thing, looking at my parents and my family, that everybody was there in their own setups. So I always wanted to do something on my own. Uh, Cons, from everybody, we always heard that it's an upcoming branch, but nobody knew what exactly nuclear people were doing. And in every conference, the title used to be unclear medicine, not nuclear medicine. So the indications were not firm, and they were not well utilized. Rather, there was a lot of referral bias when it used to be about nuclear medicine. But somehow, in 2007, the shift happened when PET CT came into picture. And when I joined nuclear medicine in 2007, the fourth PET CT of the country was installed in INMAS, that was DRDO, from where I did my nuclear medicine training. And that started changing the things because oncology as a branch was on a rise. Multinationals were coming and investing in bigger hospital chains, and cancer setups were coming. And in next 5 years, by the time I finished my DNB, there were more than 7, 8 PET CTs in the city, and everybody was looking for a nuclear medicine physician. So that was how nuclear medicine, progressed over a period of time.
If I simply say that you have been practicing nuclear medicine for 20 years now,
Yeah, 17.
17.
Yeah.
So what does a typical day of a nuclear medicine physician looks like?
So nuclear medicine has four things. One, a conventional nuclear medicine, which is gamma camera. Two, which is a PET CT, revolving around the oncology and other indications like PUO, cardiology, neurology. Three, radionuclide therapies. Four, thyroid clinics. So today, I don't think much people are practicing thyroid clinic because they are totally engrossed in PET CT, and most of the centers, they don't even have a gamma camera. So a typical nuclear medicine person, if he's practicing, like I am practicing all four. So my day is like I am doing gamma camera and PET CT from 9 to 5 and meeting all the therapy patients, and 5 to 8 by appointments I am doing thyroid clinic. So that is how the things are. It is still a diagnostic heavy branch, but you still get to interact with a lot of patients when you're counseling them for therapies, when you are explaining them their reports, when you are taking histories before the scan, and when you are doing thyroid clinic. So,
Boss, what are the biggest myths that you have heard about this branch?
so the biggest myth was that it is not safe for the radiation workers. Now, everywhere there is a radiation. Like there is a cosmic radiation when you fly, take a flight to Delhi to Bombay, you are getting exposed to radiation. And then other branches, when a cardiologist is doing angiography, he's getting exposed. Orthopedic surgeon is getting exposed when he's working on a C-arm fluoroscopy procedure. Everybody is getting exposed. But when it comes to nuclear medicine, thankfully, it is a heavily regulated branch. Now, when AERB controls the very process of practices of nuclear medicine. Like if you want to set up a center of nuclear medicine, you have to write an application to them that this is the place where I want to set up. These are the surroundings, and you have to submit the NOC from rest of the people also, who are your neighbors. So AERB is making sure that people who are practicing nuclear medicine, the patients, and as well as the people around nuclear medicine setup are safe. So all the guidelines are in place. You have to follow the guidelines of practice. So once you are done with this application, you get approval. The next step, you submit the plan, the architecture, what you are going to make. They will also approve that. And then subsequently, there are multiple steps. At every step, you have to take an NOC from the AERB. Once your setup is ready and you start practicing nuclear medicine, your radiation exposure is measured, and there are these TLD batches that we have, which we wear, and all the radiation exposure that you are getting, it gets recorded, and it is sent to an appropriate authority, which calculates it and lets you know that what was the radiation that you received in that quarter. And there are limits for radiation workers, that this is the safe limit that you can be in. So it is absolutely safe when it comes to radiation workers.
Boss, I've heard many people say that nuclear medicine people are just radiologists in the lab coat. Is it true, or does this branch require a different mindset and different set of skills?
See, I find radiologists also equal good doctors, and they are working on their set of modalities, and nuclear medicine physicians, they work on their set of modalities. So if you're planning to get into nuclear medicine, you should be ready for a few things. One, it's a physics heavy branch. You have to read a lot of physics, to an extent that you will be writing an exam which is separately dedicated to physics. You will forget for some time that you are a doctor, and you will feel like a physicist only. So that is the amount of physics that you have to read. It is a continuously evolving branch. It is comparatively a newer branch. So every few years you will find that there are new things coming up, and you have to completely be at the same pace, and keep reading and keep evolving with the branch. So you should be ready for that. Like any other diagnostic branch, you should be ready that if you are in a job market, your salaries will get saturated after a while, and you should be okay about it. And this happens with pathology, this happens with radiology, microbiology, all the diagnostic branches which are diagnostic heavy. This is a scenario. So you should be ready for these three things.
Boss, what was the need for this branch? If you can just tell me about the evolution of nuclear medicine, why couldn't it just be a part of radiology? For example, X-ray, MRI, CT scan, PET scan and everything could just be a part of spectrum, and radiology could take over everything. What was the need for nuclear medicine?
See, in Western countries, nuclear medicine is still practiced as a super specialty after you do your radiology training. In India, it has always been separate, because it started with radioiodine therapies, thyroid clinics, gamma camera, and it is more of a physiological imaging, and radiology is more of anatomical imaging. If you see, there is a difference. Like radiology is a transmission tomography. So there is a source, there is a detector, and the patient lies in between, and the images are created. In nuclear medicine, the patient itself, the patient is injected with or administered the radioactivity, and the patient itself is the source of radioactivity, and you only have detectors around it. So you are practically taking images of the patient. Now it needs to be different, because in 3 years of course, you need to teach about the physics of the machines. You need to teach how to safely handle the radioactivity, and you have to also teach about the different modalities and the clinical conditions and everything. So I don't think that a 3-year MD course can do a justice to the entire gamut of nuclear medicine. And then we are treating this theranostics, this complete nuclear medicine therapies, which will be the showstopper for us in next decade, like PET CT was in last decade. We are getting newer and newer indications. We are getting newer radiopharmaceuticals which are coming up and getting FDA approval for use in cancer therapies, and it will add to the precision oncology, like the tailor-made treatments for cancer patients. So this is the you can't make it a part of radiology, basically.
So, based upon the amount of exposure, do you think this branch is safe for women, considering that, of course, they will go into the family way in the future, and the amount of exposure of radiation they are getting on a daily basis, it can harm the fetus in upcoming times. Do you think it is safe for women?
It is absolutely safe. Rather, I have more women nuclear medicine physicians in my team rather than men. And as I said, that AERB is regulating the entire radiation exposure. So everybody stays in that safe limit. And the moment a woman nuclear medicine physician is pregnant, uh, and she tells this to the radiation safety officer in the setup, the all the radiation handling responsibilities are taken away from the physician or any other radiation worker, and the person is shifted to the non-radiation zone so that there is no exposure. So these things are taken care of.
What is the contingency plan if there is a major radiation leak? It is a possibility, right?
There is the major leaks will not generally happen in a small departments. Major episodes happen in nuclear wars or nuclear accidents. Maximum what can happen is there's a spill of radioactivity. The radioactivity is in a container and it spills within the hot lab or where it is kept. So always the radioactivity is kept in a radiation zone. And when such episode happens, everybody in the system, like the radiation safety officers, technologists, all the other radiation workers, are trained to handle such a scenario, depending upon the spill, which radiopharmaceutical is spilled over. So we lock the doors, and that area is marked unusable, depending upon the half-life of the radiopharmaceutical that is spilled over. So we all leave that particular area, and it is left unusable.
Is there any incidents of a major leak that has happened in the past?
Not to my knowledge, not in my practice, and I have not even seen anything happening in the places that I have worked. But people are trained. You know how to handle radioactivity. You dilute it and then you use it. So it is very rare. It is very rare.
People are, I've seen many students equating radiotherapy with nuclear medicine. Now, are both these branches the same, equivalent, or different?
Oh, it is absolutely different. Radiotherapy is a branch of it is a specialization of oncology treatments. Like it is a radiation oncology. You use leniacs for that, and it has nothing to as such do. Though you are treating patients with radiation, but our therapies are radionuclide therapies, and radiotherapy is using leniacs or cobalt sources. It is absolutely different. The academic programs are absolutely different. Though earlier, what we have seen that nuclear medicine, when it was not such specialized branch, some radiotherapy people used to do a 6-month course of nuclear medicine, and they used to practice nuclear medicine when it only concentrated to thyroid clinics or some radioiodine treatments. When nuclear medicine itself was a very small branch, but today it is absolutely different.
Boss, let's talk about NEET PG students aiming for this branch. So we are going to dissect this branch to very small pieces so that everybody can understand the simple pros and cons, the opportunities, the income possibilities, everything related to a future job potential. So let's start with a very simple thing. So boss, you have already given us the pros and cons. Now nuclear medicine, it is a very niche branch, I would say.
Yes.
What traits should be there in that student to actually succeed in this branch? Maybe they should click that these are the traits that would actually fit for this particular branch.
People who want to get into nuclear medicine, if you're looking for a cool branch, a 9 to 5 kind of a setting, yes, it is a branch for you. Then people who enjoy physics, you will have to read a lot of physics. People, you will have to deal with cancer patients on a regular basis. So it gets really sad and morbid sometimes for us to be dealing with them on a daily basis. You should be ready for that. From in terms of money, you should realize that when you are in a job setup, it will get saturated after a while. It's a good opportunity right now for people who want to work in government setups because uh, aims are coming up. Tata Trust is building cancer hospitals, and most of the state government hospitals, they don't have a PET CT or nuclear medicine setups as of today, and they will come up in next decade. So it is one of the branches wherein you have a good opportunity to get into government setups if you have a bent of mind of working in a government setup or doing academics, or you want to do some sort of a research and research training basically.
So boss, how is this branch divided between OPD and wards? If you had to basically segment it, that 50% is OPD time and 50% is into inpatients. So, or is it just inpatients only?
So primarily nuclear medicine is a diagnostic branch wherein you are dealing with gamma camera cases and PET CT cases. As far as the therapies are concerned, you are doing thyroid clinics, you are treating patients of thyroid cancer, and you are also doing some lutetium therapies and some newer radiopharmaceuticals which have come up. Those therapies, you're counseling them. So primarily it remains a diagnostic branch. Very, I would say less than 5% admissions happen. That too, when you give a high dose radio iodine therapy for thyroid cancer.
Boss, what do you think is a 10-year future for this branch?
Oh, it has an excellent future. As of today, the demand is huge, supply is too less. People who are coming out of academic institutes are getting absorbed within the academic institutes. So there is lack of people who are available for the private setups. Tier 2, tier 3 cities, which is the next focus of entire healthcare industry, is also looking for people who can work in such branches. And we are not getting nuclear medicine physicians in tier 2, tier 3 cities. So there is ample amount of job opportunities, uh, excellent opportunities if you want to have an entrepreneurial journey, excellent opportunity if you want to get into a government setup.
Boss, how would you define the potentials of jobs, work in a government setup and a corporate setup?
If we talk about people who have just finished MD and we want to see the pros and cons of government versus a corporate setup, I think if we say the positives for corporate setup is that you get exposure to the latest machinery because today the corporates have invested in the best of machines. Two, the soft skill development. If you in future plan to work in a private setup, the way you interact with the patients, the way you interact with the colleagues, the way you attend the tumor boards, and gain knowledge from the other oncologists in the system, it is very good. Uh, Next thing that I can think of is in private setups, uh, the life is more disciplined. In government setup, the academics are better. Uh, okay, one disadvantage of private setup is that the academics are poor. I would not say poor, but then they take a back seat. The academics in a private setup take a back seat. Two, uh, sometimes the junior person becomes the workhorse of the department and is not given the enough credit by the seniors. It happens. So the career growth in a private setup is not structured, and it is slow, and it depends on your boss, who's the HOD. So you are dependent on, for your growth, own growth, you are dependent on the HOD. So that is the problem in a corporate setup.
All right. Is there any super specialty opportunity also in this branch?
Yes. So very recently, or maybe a couple of years back, few institutes have started DM nuclear medicine, targeting the radionuclide therapies, and rather DM therapeutic nuclear medicine.
All right.
Yes.
And
So
only nuclear medicine people are eligible for this
yes, yes.
one. Nobody else.
Nobody else.
Okay. So that means they are basically filtering out super specialist nuclear medicine already from a niche branch.
Yes. And but then currently, as per the practice today, you don't have enough radionuclide therapy work in a typical nuclear medicine department. So even people who are coming out as DM nuclear medicine, they're working in any setup, they end up doing a conventional nuclear medicine work also, and not restricted, which is not restricted to only therapies. Like when a MD does DM neurology, he's only practicing neurology. When a cardiologist does a DM cardiology, he's only practicing cardiology. Currently, that is not the state. Currently, this is not happening in nuclear medicine, because once you are a part of a private or an academic setup, you are still practicing the diagnostic nuclear medicine also apart from therapy.
So, but do you think in next 10 years that will happen?
It should change. It should change with the newer radiopharmaceuticals coming in. As we move towards precision oncology, it should change. Yes.
Don't you think this branch is too much tech dependent? Tech, or I would say infrastructure dependent.
Yes. Because the machines are costly, and you can't practice nuclear medicine without a gamma camera or a PET CT. So definitely, it is just like a radiologist is dependent on CT and MRI. So a nuclear medicine physician is dependent on a gamma camera and a PET CT.
So how much do you think that post an MD, if somebody wants to start their own setup, how much investment would be required to set up the minimum amount? I'm sure you can understand the minimum amount needed to start your own setup, the infrastructure, the machines, and the capital.
We say that, okay, so the minimum amount of money with a refurbished old gamma camera, you need about 1.5 CR to start a nuclear medicine department, which is only gamma camera. It can go up to 12 CR with new gamma camera, new PET CT, and a therapy ward, basically.
And how much area would be required to set up a complete thing?
It would be about 4,000 square foot area.
So that means if we just look at a ballpark number, we are looking at a 15 crore total investment.
12 crore for the construction machines minimum. And if you want to purchase the property, then maybe, yes, depending upon where you want
Let's
to set
suppose if we are investing 12, 3 again is something which can be thought of. But don't you think that this branch is too expensive for any normal person?
Yes, to start up something like this, it is difficult. But I don't think in India, as we are growing as a country, funding loans or anything like this is very, very difficult to achieve. It is the bent of mind of the nuclear medicine physician that yes, once he decides that he wants to get out of the comfort zone, and then there are investors available with whom you can collaborate and start up the entire department.
Is there any other way that without so much investment, even 1.5 crore investment is too much for a new 27, 28-year-old guy? Is there any other way where they can start their own clinic or a setup without spending this much?
You can start a thyroid clinic in a small room, but if you want to set up a gamma camera, you have to spend at least 1.5 CR with an old machine.
That's the minimum requirement.
That's the minimum requirement, yes.
Boss, nuclear medicine. If we have to talk about this branch to our audience here, and if we have to tell them, okay, the future is bright, let's support let's suppose they are not able to start their own setup at an early stage because again 1.5 to 2 crores huge investment. How would their trajectory be post MD? What kind of job they will get? I'm not asking about the numbers. I'm just asking, okay, that they can get a job here, then they can move to this department, move to this corporate hospital, and then make a career out of this particular field.
See, there, as I said, that there are ample amount of opportunities. If you want to be in a government setup, there are vacancies which are vacant in bigger premier institute also. Every corporate hospital is always on a lookout for a nuclear medicine physician as of today, be it a metropolitan city or a tier 2 or tier 3 city. Uh, so you have ample amount of job opportunities where you want to work. Now, tier 2, tier 3 cities, they also offer you a premium. So you are getting better paid there. Your quality of life is better. You have to get this experience practically. So if I talk about myself, I also worked for 10 years at different places, gained experience, and then finally I thought of started something on my own. So
Boss, this branch has both MD and DNB. All right. Now, will you equate both, or is there any difference in the academics or the learning experience in MD and DNB?
difference between MD and DNB: one, the places where there is MD, it has a more structured academic program. Vis-a-vis DNB, the not every DNB institute is having a structured academic program. Number two, the but once the MD nuclear medicine is completed or a DNB nuclear medicine is completed, the job opportunities are still the same in the private market. It could be a possibility that when a MD student goes back to the institute and wants to join in the government institute, he is given a preference over a DNB because of the internal candidate or something. But nothing of that sort is happening in a private job market.
So, can you list for us the top 5 institutes of MD and DNB nuclear medicine?
So, good institutes for MD would be PGI Chandigarh, AIMS New Delhi, SGPGI Lucknow, Tata Memorial Hospital Mumbai. Good institutes for DNB nuclear medicine would be Jaslok Mumbai, Apollo Chennai, Narayana Hrudayalaya Bangalore, FMRI Gurgaon.
Does this branch also have fellowships after doing MD or DNB?
So once you are done with your MD DNB, there are few PDCC courses in SGPGI Lucknow. There are PET-CT fellowship courses run by Tata Memorial Hospital that you can do. Then there are some uh, exams that you write, like Fellowship of European Board of Nuclear Medicine, which happens with EANM conference every year. Then there is a Fellowship of Asian Nuclear Medicine Board, which happens with the Asian Nuclear Medicine Conference. So you can go there, write that exam, and get that certificate.
So, boss, let me ask you the most demanded question of our podcast. And that is a very simple question. What is the salary, the income potential in nuclear medicine? Just after postgrad, 10 years down the line, 20 years down the line.
If a person post MD is going to a government setup, the immediate salary would be in the range of 1.5 to 2 lakh rupees. If he joins a corporate hospital, it would be around 3 to 4 lakh rupees. And if he's confident enough of independent reporting and he joins a diagnostic center, he can earn up to 5 lakh rupees in a metropolitan city. If he goes to a tier 2, tier 3 city, he can earn up to maybe 7 to 8 lakh rupees a month. Now, 10 years down the lane, this number increases by maybe 10 to 20%. And if he's in a job market only, and if next 20 years, it kind of saturates. You can't expect a huge rise happening 10 and 20 years later. If you are independently reporting cases, this is what you primarily get. 7 to 8 lakh rupees is something that you get practicing diagnostic nuclear medicine. In therapies, you might just, there is no limit. So if you're doing therapies also, then there is a possibility that you may earn more. But this is what it is.
So, you are an established entrepreneur right now. You started your company, you have scaled it to a very good level, And guys, you can search about the company. It has scaled to a very high level now. Basically, being a nuclear medicine physician, you prove that this branch can sustain entrepreneurship. What would be your advice to new graduates who want to, become a new age entrepreneur? What would be your advice?
See, it's an excellent branch. For a new age entrepreneur, probably he's just lacking in some sort of an experience and maybe funds sometimes. So, uh, and nuclear medicine gives you enough time. Your evenings are comparatively free, so you can research, you can do market surveys if you want to set up in a new market. As Molecular, we are also partnering with younger nuclear medicine physicians who want to set up their own setups in tier 2, tier 3 cities or any other city where we are not already there. And we are empowering them in a way that we are helping them with funds and we are partnering them with them so that they can run something of which they can call of their own. And then eventually maybe in due course of time, if you want to do completely on your own, they can just do completely on their own. Once they have a knack of it, they gain experience, and funds is not a problem for them. So yes.
Great, sir. Sir, I do have a concern. This branch is so much infra and tech dependent. What about AI? In the upcoming times, AI can literally take away all the jobs of nuclear medicine physician.
One, AI is definitely going to come, and it has already started affecting the different fields of life that we are already in. But I don't think that it would completely replace a nuclear medicine physician. It can assist, it can bridge the experience gap. So probably a person who's sitting in a tier 2, tier 3 city who has less of experience with help of AI is making reports which are as good as somebody who's sitting in metropolitan with 10 years of experience. It will definitely improve the efficiency. Like if I am able to report 15 cases in a day with help of AI, I might be able to increase that number to maybe 25 to 30. So it would I think that it would assist. Where AI will have no role to play is when we are interacting with patients. AI will not be able to write prescriptions or do thyroid clinics. AI will not be able to create a tailor-made program when we are doing radionuclide therapies. And AI cannot bring that human element when we are dealing with patients. So it will definitely assist, but not replace.
So, in the future, 10 years down the line, how do you think nuclear medicine will transform precision oncology and cardiology in India?
So I would want to talk about the theranostics. Theranostic is a combination of therapy and diagnostics. You are taking a pharmaceutical, tagging it with a radionuclide, which has a property of emitting radiation, and you administer it to the patient. And once you take the scan, you know where all that tracer has concentrated in the body. So those are the problem point areas. And now you tag it with a radionuclide which has a property of killing those cells like beta or alpha emitters. And now the same tracer will take that radionuclide to those areas where you want to kill those cells. So this is what the theranostic says. We've been doing it with iodine 131, and now there are many more tracers which are coming up, like a combination of gallium PSMA for prostate cancer and lutetium PSMA for therapy. So this has literally transformed the precision oncology. And in 10 years down the lane, there will be more number of radiopharmaceuticals available to us. And nuclear medicine will have much more important role in you know uh, treating cancers, and it will be used much earlier uh, in the ladder wherein you are using the therapies. Like today you are using nuclear medicine therapies only for palliative treatment, but you will be using them earlier in the ladder of giving treatments basically.
Boss, in the upcoming times, for example, if a new MD postgrad comes to you, sir, should I settle in a metro city or should I settle in a tier 2, tier 3 city? For the next 10 years, what would your advice be? What do you think the future looks like for tier 2, tier 3
The
cities?
tier 2, tier 3 cities they have an excellent blossoming future as far as nuclear medicine is concerned. Tier 2, tier 3 cities are getting developed anyhow. They are becoming smart cities. The government is investing in terms of infrastructure, and the entire healthcare. You will see that bigger groups are consolidating, and they are now taking over the smaller hospitals in tier 2, tier 3 cities, spreading their wings. So the job opportunities will be ample. And definitely, since the demand over there is still much more than the supply, so you can always ask for a premium and get a good handsome salary to start your career in nuclear medicine there.
All right. Thank you, boss. So, boss, we asked our audience if they had any questions regarding nuclear medicine. So, they have sent us a lot, but we have filtered those out for you. So, I'll ask you quickly and let's keep it a short answer question because we have a lot of questions. What experience is needed to work in leading nuclear medicine hospitals?
So you have to be a postgraduate. Either you can do a MD or DNB, and then there are few institutes like INMAS. They're also running DRM courses, which is Diploma in Radiation Medicine. You can also do that. And once you are a qualified nuclear medicine physician, you can join a corporate hospital. Either you can join as a senior resident or a junior consultant, depending upon the vacancy.
Do you think that hospitals unethically do this thing where they simply hire MBBS or BDS who have done some diplomas, maybe DRM itself, and then keep them instead of a qualified nuclear physician?
So a DRM is a qualified nuclear medicine physician, and he has all the right to practice nuclear medicine independently.
Even if he does not have nuclear medicine MD.
Yes.
So-
Yes, it is like you do a DGO or a any
Got it.
other diploma
Got it.
in any other clinical branch, and you are a gynecologist if you do a DGO. Similarly, if you are a DRM, you are a qualified nuclear medicine physician, and you can practice nuclear medicine, including diagnostics and therapies.
So, but if all the three branches, MD, DNB, DRM, are equivalent, that means that there is no difference when you are going to give a job interview.
So some institutes, the academic institutes, they insist on having a MD and DNB for a government job. But when it comes to a private job market, even if you are a DRM and you are confident of independent reporting, you can very well take the lead and join any diagnostic center or a hospital and be the head of the department and do a good job. So that's not a problem at all.
Is there any such kind of diploma, maybe a fellowship, that an MBBS student can do after his MBBS? Any other apart from DRM?
No. So, to be working in a nuclear medicine setup as a qualified nuclear medicine physician, the minimum qualification is a DRM. And then you can do a secondary DNB also. You can be a primary DNB, or you can do a MD.
Okay.
So no shortcuts here. And secondly, for every nuclear medicine, there is a mandatory requirement to have a qualified nuclear medicine physician and to have a RSO and a NMT. So these three requirements. So a qualified nuclear medicine physician, a qualified nuclear medicine technologist, and RSO, which is a radiation safety officer. Now, RSO can be the NMT can also be the RSO, and the doctor who's working can also be the RSO of the department.
All right.
So this is the mandatory requirement.
What do nuclear medicine doctors actually do in clinical practice?
They read gamma camera scans. They do PET CT studies and read the studies, and they do thyroid clinics. They treat with the radionuclide therapies like iodine 131 therapy for thyroid cancer. There is lutetium dotatate therapy for neuroendocrine tumors. You have lutetium PSMA therapy for prostate cancer, and there are few newer therapies which are coming up.
What specific career options are available after completing MD in nuclear medicine?
So the career options are many. You can join a government institute as SR or assistant professor, depending upon the vacancy. You can join a corporate hospital, or you can join a diagnostic center and work as a consultant nuclear medicine physician.
What is the current scope of nuclear medicine in India and over the next 5 years, and why do fewer people choose this branch?
The scope of nuclear medicine is excellent. As we discussed, there are ample amount of job opportunities in government setups. corporate hospitals and diagnostic centers which are coming up. So the demand is high, the supply is very less. Uh, why fewer people are joining is primarily because of lack of awareness, because most of the medical colleges, they don't have nuclear medicine, so there is no exposure to nuclear medicine as such during the formative years of MBBS. um, there's lack of infrastructure, of course. They don't even see a PET CT. You can you imagine sitting in Delhi, Maulana Azad Medical College, LHMC? They don't have a nuclear medicine department, active nuclear medicine department. So that is the reason why there's no awareness about nuclear medicine. They have not seen a nuclear medicine during their MBBS times. So that is the reason why people are not picking it up.
Nuclear medicine versus radiology. What are the pros and cons and salary difference?
See, both are important branches, and uh, they have their own role to play in the routine clinical practices. If we talk about the salary differences, there is no salary difference in government setups. When it comes to the job opportunities, I feel that today, as of today, uh, the the salaries in nuclear medicine are slightly better than the salaries in radiology to begin with, especially in corporate hospitals and as well as diagnostic centers. The difference will be if a radiologist wants to start a radiology setup of their own, the minimum ticket size is about 50 lakh rupees. You start with a X-ray and ultrasound center. But if a nuclear medicine physician wants to start his own setup, this amount is at least 1.5 CR with an old machine. So that is a key difference, that it is quite prohibitive to start your own setup in nuclear medicine vis-a-vis radiology.
Sir, in one line, if we have to differentiate between radiology and nuclear medicine.
So basic difference between radiology, it's more of an anatomical imaging, and we do more of a physiological imaging. It is primarily based on the physiological processes in the body, and radiology is based on anatomy of the body.
So where do you draw the line that this is where radiology ends and this is where nuclear medicine starts?
I can't. You can't differentiate, because nuclear medicine is also using radiology as a part, like PET CT. When you do a PET CT, you have to have a knowledge of reading a CT scan when you are reading a PET CT. So I think both the modalities, radiology, they are collaborative in nature. They complement each other. In terms of the ultimate aim is to reach the diagnosis of the
But
patient.
can I say that you can do a radiologist work, but the radiologist cannot do your work?
Not really. You so we can read a CT, but we cannot sign a CT report legally.
Okay.
Similarly, radiologists may acquire the knowledge of reading a PET CT, but then legally they cannot sign a PET CT report.
All right. So this is what my question was. Where does radiology end? Does radiology end with CT? And does nuclear medicine start with PET scan? Or is there any other machine also in the middle?
No, there is nothing in the middle between a CT and a PET CT. I would not say that where radiology ends, nuclear medicine starts. So nuclear medicine will have its own set of indications. You don't always need a PET CT. Similarly, when you need a CT scan, you don't need a PET CT sometimes. When the advantage of PET CT is that it's a whole body imaging. So you take a snapshot of the entire body in one go. So that is the advantage of PET CT.
A radiologist cannot sign a PET CT scan report.
Yes. So PET CT is under the curriculum of nuclear medicine. So legally, it is only nuclear medicine physicians who can sign a PET CT report.
And what all other machines come under nuclear medicine and what machines comes under radiology?
So X-ray, ultrasound, CT, MRI is under radiology. Gamma camera, PET CT, and even PET MR is under nuclear medicine, because you are dealing with radionuclide. You are dealing with radiopharmaceuticals. You are administering radiopharmaceuticals to the patient, and it is only the nuclear medicine people, they are trained to handle radio pharmaceuticals.
Very interesting. Very interesting. All right, boss. Let's move to the next question. Is doing a private MBBS worth 1 crore worth it for the career in nuclear medicine?
I would not like to put a number of 1 crore or 2 crores to MBBS, but then career in nuclear medicine today is worth a while. And for next 10-15 years, there is a lot of scope in nuclear medicine.
Is nuclear medicine a good branch if you want to settle in tier 2 cities? I think boss has already answered it. Yes, it is. How much patient interaction does nuclear medicine involve versus diagnostic work?
See, primarily it is a diagnostic heavy branch, but you do interact. It is a personal choice whether you want to interact with patients while taking history before the scan, whether you want to interact post scan and you want to explain them the reports, and then you have to interact with patient when you consult them for the radionuclide therapies. You have to interact with patient when you are doing thyroid clinics.
So it is not like radiology where it is almost zero interaction with the patient.
Again, it's a personal choice. How you want to practice your nuclear medicine.
So is it comparable to radiology in the percentage wise? Or, I mean, you are saying that yes,
No,
there
I
is
think
patient
in
interaction.
comparison to radiology, definitely your interaction with patient is more.
Okay.
Because when you are writing reports, you have to take care and you have to know the problem statements. The history of the patient plays a very important role when you are writing a PET CT report.
All right. What is the scope of therapeutic nuclear medicine and which new treatment modalities are in the pipeline?
So a lot of therapies are there, and like I said, that iodine 131 therapy for thyroid cancer, and even low dose iodine 131 therapy for toxic nodules and Graves' disease is being practiced for last many decades, more than 5 decades now, and it is already established. Then for last decade almost, we are doing lutetium PSMA therapies in prostate cancer. Lutetium dotatate therapies for neuroendocrine tumors. They are also established. And now newer radiopharmaceuticals, we are now getting alpha, we are now doing alpha therapies. Then there is a newer radiopharmaceutical FAPI, so which is getting labeled with lutetium for low-grade tumors or certain indications. So there are a lot of new radiopharmaceuticals which are coming up in due course of time.
All right. With this, we come to the end of the audience question, boss. We'll now move to the rapid fire. And our rapid fire is very simple and just 2 rules. You have to be super spontaneous and super truthful. Jo dil mein aaye, directly bolna hai. Favorite dish to cook or eat?
I am a dal rice person.
Fully.
Yes.
Okay, physics or chemistry? What's your favorite one?
Physics.
I hate physics. इतना तो I'm confirmed कि nuclear medicine मेरे बस की नहीं है. If you could swap lives with someone for a day, who would that be?
I would not want to swap, but I would still want to actually closely look at the lives of Dr. Naresh Trehan sir, Dr. Devi Shetty sir, like how they are managing their clinical domain as well as the kind of empire that they have made from small setups, and what goes behind their mind when they are taking decisions.
Very true. पता नहीं कैसे करते हैं और जो किया है वो
great.
कैसे है. I can't even imagine. What's your biggest goal in life right now?
So, as a co-founder of Molecular, we are focusing on social entrepreneurship right now. We want to make nuclear medicine services available in tier 2, tier 3 cities, which have best of infrastructure, self-sustainable models, and affordable to the common man. So that is the aim currently, that reach out to the people and serve them.
Sir, may God give you that power to serve each person in India and in the upcoming time the world. Make world a better place, sir. What is the best piece of advice you have ever received?
ABC, availability to the patients, your behavior towards your patients, and the cost to the patient. So if you are taking care of ABC of practice, I think you will always succeed in life.
Happiest moment of your life?
Many of them, getting selected in Maulana Azad Medical College at the time of MBBS, then starting my own center, getting a gold medal during my post-graduation. So these are the...
All right, sir. Thank you so much. With this, we come to the end of the podcast. Thank you so much for dissecting the complete branch for us, showing us proton, neutron, and every other thing, telling me that I am really not fit for nuclear medicine. And guys, you have to be really, really good at physics to actually enjoy this branch. Thank you so much, sir.
Thank you.
And thank you so much, guys, for watching today's podcast. Nuclear medicine was one of the most demanded subjects in our comment section. So I believe this is one branch which is going to be amazing when you watch this video. इतनी सारी physics, इतनी सारी chemistry, 1 घंटे के अंदर. It went above my head. But I am sure that you guys are intelligent enough to make an informed decision now. Share this with each and every friend of yours who want to choose nuclear medicine as a career option. It has an amazing future. Let's make India great together. Thank you so much. And before quitting, make sure you like, share, and subscribe. Thank you so much, and God bless you.